Okay, welcome everybody to another edition of Conversations with Dr. Cowan and Friends. And as probably some of you know, some of the friends are people I'm just meeting, but that's not the case because I've known Adam, 2 years? A year and a
coming
half?
up on 2 years, just over
2
now.
years. Yeah. So he's an old friend. One of the things that's happened during the quote COVID is we've all made new friends, at least a lot of us. So 2 years, that's like an old friend. Like we go way back.
Seems like a lifetime, Tom.
Yeah, seems like a lifetime. So what we're talking about today, we have a new initiative. I think we are sort of calling it a clinic, but that may be the wrong name. And it's called the New Biology. I like the word initiative, but maybe clinic. And I just thought I would give a little bit of an introduction, Adam, about what this is about for me. And you're going to be the first practitioner staffing the New Biology Initiative. So then we'll get a chance to hear who you are and why you would want to be part of such a thing, if that's okay.
Yeah, I'm excited to hear what you have to say, Tom, as always.
All right. Well, like always, I'm making it up on the fly. But so I did medicine since, let's say, 1985 till 2020. So that's 35 years. Family sort of general practice. I usually worked anywhere between 2 and 4 days a week. I always pretty much had full patients all the day that I worked. So I don't know how many patients that is, but it's a fair amount. And then when I moved from California to New York, I stopped doing medicine. So the question that I wanted to ask myself, why did I stop doing medicine? Well, there was, a little bit of legal issues involved, but that wasn't really the main reason. The main reason was after 35 years, I thought I needed a break. Now, interestingly, in these last 2 to 3 years, where I haven't seen any patients, haven't done any kind of medicine, we've had lots of people write to us, call us, email me, Tom, I have such and such, can you help me? And a lot of times I actually thought I probably could help them. But I actually decided and stuck to it. I saw nobody as a quote patient or even did a sort of off the cuff, consultation. And when I was thinking about why, because sometimes it actually kind of broke my heart. I heard some story from somebody who was doing something which I would never do and I thought was harmful, but I just didn't ever once say anything. So why did I do that? It isn't that like a cruel and heartless thing that I did. I think there was 2 reasons. One, because in order for me to do what I think of as effective medicine or counseling people, I realized I had to be in a certain, I'm not sure what the word is, but like headspace. And for me to just, okay, I'll talk to you about your medical problems, just sort of one off. It's sort of like a golfer or a violinist who decides, oh, I'll just pick up my violin and play every once in a while. And you're just not in tune. And so I thought this is not really doing a service to the patient, to the person who's asking for help, because I'm not really up on my game here. And so that was the first reason. And the second reason was I thought after 35 years, I needed a break to get a perspective on what I had done those 35 years and like where this should go. Now, the people who've been listening to me know that I used to believe in viruses, and I used to think genes made proteins, and maybe they still do, and there were cells, and there's a whole lot of things. And I think it was really because I allowed myself to get away from it that I could take a look at all these things, because I wasn't beholden to thinking in a certain way in order to treat people. So I got some distance, and I think that allowed me to see that, in fact, we've been sold a kind of song and dance since the late 1800s about what is real in medicine. And it's under the rubric of germ theory and cell theory and, you know, endocrine theory and even biomolecules and genetic theory. And when you go looking, you don't really see much evidence that any of these things are actually real. And then you start saying, so what is real? And how does that impact how you interact with a person who's not doing well? And I think out of that came this new biology initiative. So then I thought, well, okay, I'm just going to sit on this the rest of my life and just say, well, if you need help, you're on your own, you know, don't worry about it, or something. But eventually people started asking me, you know, could I help them learn this new biology initiative, even though in some ways I just was learning it myself. And Adam was one of those people. So can we talk about this, he said. And there was a number of people like this. It's sort of called mentoring, but I don't really like that word because that makes it like I know and you don't, and that's just not the way it really is. So we would talk, and we would talk about what's real and what isn't real, and what would you do if somebody said their foot hurts, and what wouldn't you do? And out of that came a way of finding out what was wrong with people, finding out what to do about it. And then it got to the point where I thought, well, we could put this into practice. We could actually use this information to help people. And then I had to ask myself, do I want to do that? And I heard from inside a resounding no. I don't want to step back into that. I think I'm better served myself and what I can do for the world by being a little distant. I could be wrong about that, but and then I thought, well, who's going to do it then? And I tell you, the first person I thought of was Adam.
Wow.
Anyways, well, I'm talking to today, I didn't even introduce it. Adam Wuollet, that's how you say it, your last name, right?
That's right.
Yeah. And it turns out Adam was in a transition, and so one thing led to another, and Adam has agreed to be the first person who practitioner, maybe call it, that somebody who joins this initiative, and we'll eventually tell you how that's going to work and the rules and what you quote get and but the first person you're going to talk to is Adam. And I'm going to be involved, but I can tell you, I don't think I need to be that much involved. But I think the reason I'm going to be involved is a lot of it is I just want to see how it all goes. Not that I'm like have to tell Adam what to do, because that's just not accurate. But it's good to talk to somebody sometimes. I mean, I've done that, and we all do that. And then I just want to finish with a story. And I heard this story when I was being interviewed a few days ago. And frankly, I don't even know if the story is accurate, but it sounded accurate. And it gives, I think, a flavor of what new biology medicine might be. And this was a woman who grew up in Colombia and had something to do with shamans and medicine men in her native country. And then she moved and became a nurse and worked in medicine. And she ended up, a friend of hers, I think it was, a young man in his 30s, ends up with pancreatic cancer. And he had grown up in this family of medicine men, shamans in rural, native Colombia. And he had decided, he turned his back on all that. He didn't want to move to the city and worked in tech and drank and smoked and all the rest of the things that young people do in Colombian cities probably. And he got pancreatic cancer, and they gave him 6 months to live. And he goes home and he says, what am I going to do? And she described what they did, which was like bury him in the earth for day at a time, like 8 hours. And he had to lay naked in the sun, and he had to take herbs. And he had to, they said the reason for this was you lost your connection with nature and who you were meant to be. You were born into a family of shamans. So some people could live that life in a city. That's sort of their, path or their destiny. But you couldn't. You tried, and that's what happened to you. You come home, and then he got healed. The whole thing went away, and he became a shaman and lived for another 30, 40 years and never came back. And I think that's what we're talking about.
Yep.
Now, I don't know if that's going to happen to everybody. Like I said, I don't even know if that's a true story. I suspect it is, but that's the new medicine, reconnection with nature and who you are and what is your story. And I think I'm going to stop there. And so that's why we wanted to do this. And now I want to introduce my friend, Adam Wuollet. And Adam, tell us who you are, why you want to do this, how did you get here, and anything else you think is relevant here. And welcome.
Thank you, Tom. No, it's a great pleasure to be talking to you again today. And just looking back over the last couple of years, before I first met you, Tom, I would have never imagined I would have been sitting here today doing this. So this is something. Yeah. But it's what you just said obviously resonates with me about the story you told, and about a lot of what's wrong in the world right now is we're not connected to what we should be. Right, we're connected to artificial things, fake things, and once we get more grounded, connected to each other through, like you said, through story, the loved ones around us, and the nature around us, which nourishes us, it really comes down to some simple things, the sunlight, the energy from the sunlight, the air we breathe, the energy from that, the water that we consume, and the food that nourishes us, and from the soil and that. So these things are very basic. But if I step back and kind of talk about my journey, I do agree that we each kind of have a path, and until we really walk that path, we really don't know what it is. I remember as a young child asking, people that had been, adults and kind of taken a certain path in life, and ask them how they got there, and trying to figure out, what I wanted to do. And, a lot of them said, you'll know in time. And that's what I found true. And especially in these last couple of years. So I started off, fairly young, knowing that I wanted to be in the healthcare field.
Was there any reason for that you know of? Like, did you see somebody who was sick, or had just had an interest or something? Because I didn't have any reason except that's what everybody told me I should do.
Yeah, I look back, there were definitely a couple experiences I had that were impressionable. One of them actually was going in a middle school field trip to see open heart surgery. This was in Phoenix, and they had a heart center there where they had a observatory where you could watch. There was basically glass, so you didn't have to scrub into the room. And you could observe it. And so I don't know if it was that instance, Tom, but that something about that drew me to the interest of the heart for sure, and health. But I just found myself, for instance, I grew up in a large family. When my mom was sick and all my brothers were gone, even going on big trips or something, like would have been really hard to resist. I found myself the one staying home and helping my mom.
Wow.
And I didn't have any, obviously, real experience or knowledge about caring for anyone. Just was there to take care of her needs and accompany her. But I really, when things come full circle, those things I found are so important. They are the biggest things.
Yeah.
And I think that's, Tom, you've talked about, the gift of COVID, and I think some of these things, as hard as they've been to see happen, with the isolation or whatever it is, what they do is they bring to the forefront how important it is for us to have connection to others.
Yeah.
And so that's that. Again, I guess it has to happen that way, and maybe to really make it that clear for others. But so yeah, I kind of knew at a young age I wanted to go into medical school, and so I always thought I was going to be a cardiologist. Again, the heart fascinated me. I really felt like in many facets, the heart was, that's really defined who we were, as far as, the physical heart, as far as, well, back then when I thought it was a pumping
Yeah.
mechanical organ. But even, when you look at a deeper sense of our heart and where love comes from and resonates from, which I think is even more profound than, which is hard to imagine, because our lifeblood is our life. There's no blood. I think if anyone that's seen anyone unfortunately lose large amounts of blood hemorrhage, there's not going to be life after that.
Yeah.
But, I think even more profoundly is the love that resonates, and that connection from the heart there. So I went into medical school. Actually, I did a study abroad in Ecuador. So I went down and I studied indigenous medicine right at the end of my undergraduate studies. So, and my father, especially, he was, more holistic approach. He, looking back, obviously it was more of the chemically based, alternative medicine with vitamins, probably not so much the true source of, good nutrition. But he was always, they weren't taking medications. They were looking at vitamins and stuff like that, and trying to do things on your own as much as possible, and living a healthy lifestyle, staying active, all these things. So
Yeah. Was he a
I
healthcare practitioner or no?
no, so yeah, I'm the first one in my family that kind of took this path.
Yeah.
And so then I went to Ecuador, studied some indigenous medicine, and actually when I was down there, found out I got accepted to medical school. So it's, it's a big thing at that time in life. And
Were you like an apprentice or training with a medicine person?
no, it was a study abroad. So I was in a full semester abroad, and I was just taking different classes. I studied Spanish down there and culture. I just knew I wanted to take a break before I really delved into the intense studies of medical school.
Yeah. Okay.
So that was a great experience. And then I came back and went right into medical school. Definitely not an aside, but not aside of the topic at hand. I found my wife to be down there, and so it was one of those experiences of life that never imagined would happen. And so went through medical school, and when it came time to, as most people probably realize, most physicians then will start to specialize, and this is kind of that compartmentalization of science and medicine, where everyone gets so expertise that you can't talk to each other basically, and you can't even talk to other people that haven't gone to the same training. So when it came time then to apply for which specialty I was going to go into, I had been going through my rotations, and I'd gone through surgery and gone through pediatrics, and I went through cardiology. And when I realized kind of what it really was going to be like, and I had a hope of having a family, I just didn't see how those were going to fit together.
Yeah.
Showing up at 4 a.m. and rounding at 10 o'clock at night and being on call every third night. I really sat down, and so I came to a conclusion that, that wasn't my path. And my wife wasn't excited about that, because she knew when I met her, that was my passion. I'd kind of explained that I knew the heart was really what I wanted to focus on, and cardiology was the specialist I wanted to go into. And And then so she wasn't going to allow me to, she's like, no, you got to follow your passion. But I had a change of heart at that point, and I actually applied for anesthesiology residency. And I really at that point knew I wanted to start treating people in pain. And so I guess that's really, when I look back, as a child, Tom, when I saw people suffering, I guess I just felt like I really wanted to connect and help people that were suffering. And when it was something physical, physical pain, it's pretty obvious that they're suffering. And there's all kinds of other types of suffering that are silent and not so visible, and maybe not considered painful. But so it's something I went into and studied in a program that did have some holistic training, and so I always had that in the back of my head and wanting to bring that forward. That we worked with alternative practice physicians, and they did acupuncture, and so
this was sort of anesthesia with also pain medicine, pain management stuff.
Yeah. And so it was kind of a little bit out of the box, always never really fit in. And I guess I skipped ahead from medical school. My experience there, Tom, was that you mentioned at the beginning about some of these things just that aren't so. I was the student up in class after lecture, after genetics class and immunology, and these various different classes, asking questions because it never really added together. Molecular biology and the machinery of the cell, it just didn't resonate. And so obviously I studied it so I could pass the test and move forward, but it really never answered. And so I think I was a little bit of a pain in the butt for some of the professors. I honestly went up there at that point trying to understand, but looking back, it was obvious that it just didn't answer to the way I really felt like the world was made.
Yeah, got it. It's interesting. A lot of us, there's this sense, and we don't even know what to do with it, and we keep thinking it's got to be right because everybody thinks so, and somehow it just doesn't add up.
Yeah. And I heard a quote not too long ago. I think it was a Victor Schauberger quote that said that we think the things that are difficult to understand are the most profound, and it's not true.
Yeah.
The things that are difficult to understand are that way because they're false. They don't answer to the heart because they're not true. They're not real.
Right.
And like you and Tom said, as we really connect back to nature and who we are, then we have that better lens to see what is real and what is not real. And so so the profound things are, I think the things that are really profound are in nature are very simple and beautiful.
Yeah.
So
it's an amazing revelation. It's actually incredibly profound. And I used to put it like, I mean, this is a little bit of my arrogant streak, but I used to say, if I wasn't getting the answer to the question, then the question was wrong. There's something flawed in the question, or it just there's no way to make sense of this. In which case you have to look at it from a whole different point of view, because there's no way that you can keep going with that. It just doesn't. It's just the question's wrong.
Yeah.
So
I went through training and then started practice, and definitely practice in modern medicine. The connection.
It wasn't as an anesthesiologist, more as a pain management
doctor. Yeah.
Not putting people to sleep so much.
Nope.
Yeah.
So I was seeing people, patients in clinic came in with everything from headaches to joint pain, and I think that the largest percentage of patients with spine, back pain, that's probably the most common complaint. So these are chronic pain issues, pain that people have had for a while, not coming in with an emergency of this hurts or that hurts. And so it was interesting, Tom. I started to find out, to realize that for some of these patients, I was starting to become more of a general practitioner to them than their own PCP, their own primary care doctor. And they would come to me, and I wasn't the one reaching out to them, but they would come in and start asking questions about what I thought about this or that. And the patients that were also looking probably for more of a holistic, natural approach to, and some of them I think were just looking for someone to listen to them, Tom, because
Yeah,
one of the most
totally.
profound experiences I've had in my practice, I've seen some people that have just been in severe pain, and do daily activities. Pain was so intense, not for a day or a couple of days, but for years, sometimes decades. And some of these patients, they had basically at the end of the road, they had seen so many different doctors and had spent so much time and so much money searching, and they come to you. And when I was looking to help them, sometimes it was interesting when they come back to see me for a follow-up, and I would get their chart and it would kind of have what their, the pain level, everyone gets this subjective pain level. And I would go in there and I'd kind of be disappointed because it looked like there wasn't much progress. I wasn't helping them. And sometimes I'd open the door and some of these patients would just start crying, literally tears coming down. And they would say, Dr. Wuollet, thank you so much. And I would try to stop them and say, no, like I want to help you more. It looks like you haven't seen much improvement. And they're like, no, you're the first person that's truly listened to me.
Yeah,
You wouldn't believe how many people I've gone to, but you're the first person that actually listened to me. And as I've come to understand, pain, is part of the healing process with a lot of conditions. And so just like a lot of the misconstruement of what's going on when we think we have illness or disease, we think it's something bad. That's from a mindset of our bodies are dysfunctional.
yeah,
Our body, there's something wrong with our bodies, but they're miraculous. But we do have to go through some of these processes that are painful sometimes, and whatever the symptoms are, most of the time it's the body's effort to try to heal. But when
yeah,
we're not giving it what it needs, or we're suppressing it with medication or negative thoughts, whatever it is, fear, that I have this scary disease or this bug is going to attack me, those things derail and work against our body. And then we start to battle against our own healing process. So that was
Adam,
really
I just wanted to stop you for a minute. That what you said was so similar to my experience. I don't know how many times I would have somebody come in with, say, lupus or I don't know, rheumatoid arthritis or Guillain-Barré, and they would come in, they would tell me their symptoms, and I'd listen to them in the way that we both have learned to do. I'd really listen. And then I would see them again and I'd say, how you doing? Oh, so much better, so much better. How's your lupus? Yeah, I still have lupus. I don't worry about it so much anymore.
yeah.
In my early years, I thought, wait a minute, I'm all I care about is curing their lupus. And they would say, yeah, my joints hurt every once in a while. I'm fine. And I just thought this is the weirdest thing, but it's exactly what you're saying. They were so much better and they were so thankful to me. And I'm like, oh, this didn't work, and they still have lupus and whatever. But
Yeah, that's what you just said. You've talked about the labels of disease, these different names diseases get put on. And again, what we understand is very different than that. These are not a lot of times these are just the healing process, from whatever it is. And a lot of times it is something emotional, or it's not always something physical, right?
Yeah.
Especially nowadays with the fear that's going on. And that's pretty incredible to see how that plays out societal wide. But it's the disease part, when you get so focused on the label, you really forget what really matters, and that's what I've seen in stepping back and seeing this from a different way over the last few years is, that experience. I was so perplexed when I first heard patients describe that they were just so emotional, about how it had impacted them.
Yeah.
And yet, if you focus on the disease label, it's still there potentially, even
Yeah.
if it's a fake disease label. But we really focused on life, how are you living, and they just were just overflowing with gratitude. And that's for me, Tom, what gives the greatest gratitude. And it's a great privilege, because it's not anything really in the end that you or I have to know or do. We're I think guiding people. And that's really takes a lot of pressure off, because growing up, I'm sure you experienced it, Tom, our schooling, these systems are very competitive. There can be a lot of pressure put on you to know, and you have to be the expert, and people are coming to you, and it's a lot different, because that's not the way life works. It's not up to me or Tom to do this. We can help people, you can guide people there for sure, but in the end, it's your own body that's gonna allow you to heal when you provide it what it needs and take away the garbage.
And again, I don't know if you saw this, but the person who's full of gratitude and feels so much better, and they can do so much more. And then, like, especially quote normal doctors, they look at the MRI, and I would do that too. And by the way, nobody goes to a pain doctor who's not been through like years of trouble, right? Because you just don't go. You do your opiates or whatever first. But anyways, so you see the MRI is the same. Sometimes it's better, but sometimes the same. Person's so much better. They're so grateful. They have their life back. And again, for me, I used to, this is terrible. I didn't fix their MRI. And I was quickly learned that that's not where it's at.
Yep. Well, it's true, Tom. That's unfortunately where, a lot of,
Yeah.
For sure, surgeons, if it's just a physical thing, they're trying to fix the image, instead of fix the person. We're much more than a MRI image,
Yeah.
So.
Yeah, when you start getting into it, it's really hard to know what those things even mean. So, and I'm sure you know a lot about that.
Yeah, it's, because it's the big thing with that is there can be changes over time, but when you put a preference, or priority rather on that over who's sitting in front of you or who you're talking to, that's where you can go awry for sure.
Yeah. So maybe give us a sense of what your, I don't know if the word strategy, or what would it be like for Joe Blow or Mary, whoever, to call up and say, I want to talk to Adam and see if he can help me? What would happen then?
Yeah, so I just going back briefly, Tom, when you did that introduction, I think what you've been providing, the information you've been talking about, on a high level, can help so many of us. And I've learned so much from you, Tom, over the last couple of years. Things you brought to light. And I think for a lot of us, simple things, we have these common experiences, common cold, and that's obviously, I know you've talked about these things. We don't need to go into detail there, but we have these common experiences. I think that a lot of us with a little bit of knowledge, we can see things that can help us with these different illnesses. But I think, really this new initiative that we want to come out with are things maybe that are more difficult, and people are having more difficult time getting through.
Yeah.
And so I think really at the core of this, Tom, is like you said at the beginning, is the story, right? And this is something we've talked about, you've talked about, is each of us has our own story. So there does become a time where it's not this common experience. And that's where I think Tom was alluding to, that you really need to be in the right headspace and really understand and connect to that person. Because if you start doing cookie cutter medicine, which is modern medicine, it's cookie cutter, there's algorithms. And so that's a totally different approach, because, if I don't know Tom and he says he has something going on, there's a lot, there could be a lot there, and
Yeah.
sometimes it's very obvious. I was feeling good, and then, I rolled up my sleeve and they jabbed me here, and then,
Next
my
thing you
face
know.
is drooping and I can't feel anything and I have shocking pain. And I saw, so those, there are the obvious, but then, a lot of this, kind of understand is there, when you look at the cause of illness, you get to the root cause of things, there's physical things, but then there's also the energetics, emotional trauma and conflict that we all struggle with internally. And I would say is we probably have a bigger problem there, because it's not recognized, if even given any lip service, it's
Yeah.
not even really acknowledged, let alone talked about, as far as how do we get through these. And so a lot of times that is maybe helping someone peel back those layers of how did I get here, and what's going on, and how do I get out of this.
Yeah.
So I think getting to the root cause, again, when you look at a lot of things in life and nature, a lot of times it is the energetics that is the cause, and then the physical manifestation is actually the effect. So,
Yeah.
the cause is the core, and that's what I think really got to look at getting down to. So that's something I've been, working with Tom on, and just trying to understand that, as I've been learning from Tom, and spending time visiting over the last few years, is how there's a I guess an art to that, maybe a science to that, is how do you interview someone and talk to them, and I think it is, a talent or a skill you can work on. And so
Yeah.
really allowing someone to open up and connect, because we're all at different levels, we're in our journey. And so I've found that's one of the biggest things is most physicians don't spend any time trying to connect nowadays. It's, you got your laptop here, and I wouldn't believe how many patients came in and said the doctor never even looked at me. If they did, there wasn't any connection made, there was no relationship made. So
Yeah.
it is, someone is going to try to help you, guide you to health. There has to be at some level, understanding where you're at, so you can connect and help them get to where they want to be.
Yeah. So first, it's essentially you're creating a vessel, and in the vessel emerges the story, and the story tells you the first cause. It may not be the final cause, but the first thing that happened that provoked whatever the experience the person's going through. And then you interface with that cause. If they got poisoned, you deal with the poison. If it's emotional trauma, you help them work through that. Whatever it is, help them work through that. And then maybe there's a deeper cause, and then a deeper cause, and you just keep peeling back the layers, and then you get to the end of the rainbow and realize you were always there in the first place.
Yeah. Yeah. And a lot of these things, Tom, are it's incredible, and, so again, coming from, I've thought it in the last couple of years, why did I go through all the training and schooling, in immense amount of time, and, all the funds, the money that went into my training and all that. But I think it is helpful. I think if I didn't have that experience, it might be more difficult to kind of help guide people from that perspective of what we've been taught in our schooling. And obviously this goes beyond even, like medical school, ultimately for me, but even in our basic biology, what we're taught in grade school and high school and college or whatever, the sciences, the study, how living things work it's pretty basic. There's the basic elements, that ancient people understood was, there's energy, fire, there's air, there's water, there's earth, there's the minerals of earth, and it's a incredible, beautiful system, and it's a lot simpler than what we were taught, because there's no end. I mean, when you look at all the textbooks, you read, and then you look at nowadays, all the studies coming out of science, it's just incredible. I don't even know how many publications are coming out, that don't even probably get printed anymore. They're just put on the internet, but it's an endless amount of information that's just based off of false models that are, are not true, simply not true. And obviously, some of these are pretty in the forefront in the last couple of years, whether it's the germ theory, genetics, and the one thing with those is they're always, fear provoking. They bring anxiety and fear that this something out of your control is going to come change your genes, and that can't happen. Or there's, some
It's
virus
just your
that's going to come,
genes.
it's going to come
You got
attack
nothing
you.
to do with it.
Yeah. And that's the other part, Tom. It takes away your personal responsibility. There are consequences to your action. There's cause and effect in this life.
Yeah.
And if you don't believe it, then if someone unfortunately runs right into a wall, you'll realize there's cause and effect to different things.
Yeah.
So.
And maybe I thought if you wouldn't mind sharing, you told me the story about, I think it was your shoulder, just as an example of something that probably wouldn't have healed, that because of what you have learned, sounds like it did heal. Maybe if you could share that story.
Sure. Yeah. So we are on a family vacation on the beach, and a lot of wind out there, throwing the Nerf football through the wind and threw my shoulder out. And so went home, and it was, pretty painful. Kind of seemed like it was taking a normal course of healing. Seemed like it was slowly getting better, but initially the first few weeks was really painful, difficulty sleeping. Started getting better where it wasn't, kind of a daily pain, but still was having trouble maybe throwing or using it for certain motions. And then kind of seemed like I was kind of right on the precipice of getting better. Woke up one night and I was stretching my arm back and felt a pop and severe pain. And it was worse than it was to begin with at that point. And I was like, oh, okay, this is something snapped there. And so
and you're very
that
familiar with these kind of things in your work.
So I was pretty certain at that point I tore my labrum. And so I actually went and got an MRI, and the MRI showed a complete labral tear, which is considered a surgical fix only. There's different injuries. If you go in with like a rotator cuff injury and it's a certain tear, it's known that over time that can heal. But modern medicine, if it's a complete tear, that's surgery. It's the only option. You go straight to the surgeon. So I wasn't interested in that. And so this was actually in the last couple of years. So some of these new modalities we're looking at, I had used the sauna space, near infrared sauna on that. And so when I started putting that energy on that shoulder, so it wasn't immediate. So this was actually some time, and it was that nagging injury. I knew I had torn the labrum, and the pain was actually a lot more severe than it was before, and I wasn't able to use it really for anything more than just daily activities. It came to a point where I was like, I need to look at something else. And it was pretty profound healing that started happening after I started putting the near infrared on there. And so we see again with these core elements of fire or heat, that's what our body needs to heal at certain times, and obviously nourishing it what it needs. And so making sure we're getting the proper nourishment and nutrition, it's completely fine. I can throw as good as I ever have before, and didn't have to go through surgery. So these are the amazing stories that when you're stuck in a model where surgery is the only option, or this toxic medication is now you're so sick you really need to take this toxic medication, and these things all have, as we know, very real potential side effects and complications, where natural things, they don't come with side effects.
And you did some aqua cure on it as well, I think.
I at that point just started doing the aqua cure as well, which is, molecular hydrogen, or the um, plasma form of water, the Brown's gas. And I think that, the energy that provides through the hydrogen is really is profound healing as well. I my experience with that, Tom, is, I'm in my early 40s, but I've done some physical exertions that I would have done like when I was 20, and I was probably peak, fitness. I was very, very active, very
Yeah.
fit. And I have done stuff that I would have been pretty sore after doing some of those events recently, when I'm not as in good a shape, and, felt no soreness. So it's amazing, recovering, and the healing that I think helps give as well. So I think there are some amazing tools that we have to help people. And they're not, unfortunately they're not known, by mainstream medicine.
Yeah.
But they're tools that can definitely help us.
Yeah. So essentially then, once you hear the story, and again, we may talk about some, and, we'll probably talk every week just because so I can be nosy and hear what's happening. But then you can sort of match them, well, you have this, so why don't you put some more heat on it, or light, or take more minerals, or eat better, or we need to talk about your relationships, or whatever it is. That's how this is going to look. And then they, do that for a week or a month or 6 weeks or whatever, talk again. And that's basically what we're talking about here.
Yep. Yeah, I think kind of it seems like the people that have reached out to you, Tom, that have been looking to someone to help them, directly, they really want someone to hear their personal story.
Yeah.
That's really what we want to do here. So, I mean, I think it's a really exciting time. I mean, I think, again, as much as we've seen, unfortunately, a lot of harm done.
Yeah.
This is, I've never seen a more exciting time as well, because I think what we're changing here, the whole model is shifting. And I think a lot of people are waking up and looking for it. I saw it in my general practice as well. Over the last couple of years, more people were saying, what, I don't understand exactly what's going on here, but this doesn't add up. Something doesn't make sense here.
Yeah.
So I think the people that want to follow their heart, and been saying, and what we're talking about today really resonates with them. I think this is going to be really exciting, because we can build this together. We don't have to look at Tom or I as knowing all, but we can definitely help you get to where you want to get with health, I think. So
Great. Adam, this is really exciting, and I'm just so appreciative of your participation, and I'm so glad people got a chance to just sort of hear who you are. And it just makes me feel really optimistic and happy about where we can take this. And then we build one step, and then we make a curriculum, and then we help other people learn how to do it, and we hopefully change somewhat the face of medicine, so that it's a much better world we leave than what we came with.
Yeah, Tom, that's, and these things, again, it's all connected. This has to do with how you're living in your life, and in every which way. And so we've been homeschooling our kids, and when you talked about curriculum, I think it's so important that we help to educate everyone, from practitioners, others that are helping people, to anyone in the population, but especially our kids as well, as giving them, and again, these things, I think the truth is written in our hearts. A lot of the stuff, when I think back, Tom, is like I've learned so much from you, but a lot of the stuff is just like somewhere deep down you knew it, but you just never let it come out, and it's like, wow, okay, yeah, that's the way it is.
I think it's a lot more of that than it's just, people, you don't learn anything that you didn't already know.
And that's, to come full circle, is when I actually, the first time I heard you speak, Tom, right at the beginning of this, you know, a couple of years ago, it was just everything answered right to my heart, and it was like, wow, that's the way I see it. Yep.
Yeah.
And so then when I when I knew that, you know, I wanted to get further into this, and I reached out to you, you know, I would have never imagined today we'd have been sitting here talking
Yeah,
about
right.
this. So that's the amazing thing is, you know, the possibilities are really endless. So I think
Yeah.
that's what we need to focus on is we need to, you know, we need to obviously there's definitely importance of exposing lies. You know, again, you can't get to the truth if you're believing something that's false. So I think that's a big part of it is, you know, seeing it for what it is, and then in the end focus on all the good that we have, you know, the truth and the things that are honest and the things that are, you know, real. Those
Yeah.
are the things we can focus on, Tom.
All right, Adam. This was great. I just, again, so looking forward to it. Thank you so much for joining me with this and joining in my life. It's a gift.
It goes well. It's mutual, Tom. I want to thank you as well. I really appreciate you reaching out to me, and this is it's going to be a fun journey together. So
All
look
right.
forward to it.
Okay, everybody. And thanks for watching. And we will let you know all the details and how to sign up and what all the fees and everything that has to do with it. And there's some other exciting stuff about movement, and we'll be adding more people, and we're off to the races. Thank you, Adam.
You bet. Yeah, look forward to growing this team. That's what it's all about, is community, and we can grow a community here together. So
Okay. Thank you, Adam. Bye-bye.
bye-bye.